Hello, I'm Emma Howard and I'm joined by Dr. Sue Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
Got a question about eczema. My daughter has eczema and my doctor insists on prescribing steroid creams, but I'm worried about the side effects and wants to know what can I do to help her rash.
Eczema is another very common childhood problem, and fortunately the good news is it tends to get better as children get older. In the first place, I think simple things you can do to prevent eczema is always dress your child in cotton, no synthetics at all, and also always use non-biological washing powders. So those are sort of preventer things, and wool also can irritate skin, so just cotton. The next thing is use emollients. So emollients, by that I mean the sort of creams that don't contain anything active, but they're nice and smooth, and they
don't smell of anything.
There are a whole number of them on the market, but
and you can get them prescribed.
You can get them prescribed as well, and you can also get stuff prescribed for the bath to use instead of soap. So again, to use on the skin, and keep your daughter's skin really, really smooth and greasy if possible, because the greasier, the less likely it is to dry out.
Yes, there's oil you can put in the bath.
That's right. Beware though, because making the bath full of oil makes it very slippery.
Yes.
So you have to keep a special eye on your child if they're in the bath with eczema treatments. But getting back to the steroid creams can be really helpful, and a lot of parents get very upset by the idea of using steroids on their child's skin. But they do come in lots of different grades, from very mild to moderate to very strong. And your doctor will think carefully about whether your child needs some very mild steroid cream, just to get rid of the redness and the inflammation quickly and early to prevent it from getting worse. And I do strongly recommend that if your doctor is saying that, you go with that and get rid of it, and then use the emollients very regularly as well, so that you keep on top of it.
And is there a theory now in treating it that you knock it on the head, that instead of kind of trying to get rid of it gradually, you go for something that gets rid of it,
yes,
and then you just try to stop it coming back?
Some parents tolerate really quite nasty eczema in their child. They're itching all night, they're covered in dry, scaly skin because they're afraid of using something that's going to get rid of it. There is no actual curing of eczema. This is the problem. What you're doing is you're keeping it at bay the whole time.
And do you think that there is a dietary connection? Lots of people do, but some doctors don't think there is.
In a very few children, there's undoubtedly a link with such things as dairy products, but that's the minority. And it may be that your doctor thinks it's worth doing a few tests to see if there is a link. I do strongly recommend not just randomly trying a diet with your child and seeing if it works, but actually doing it with the help of a doctor.
And of course, those tests on children can often be non-invasive, can't they?
Exactly.
Much more gentle than you might think.
Yes, I mean, there are two sorts of tests that might be used. One is skin prick testing or patch testing, and the other one is a blood test. They all of them involve a bit of something. It's not that straightforward. So if you are going to test a child, you need to think about it quite carefully and have it explained.
Sue, thank you very much. And if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.